Good morning and welcome to Global Healthcast, brought to you by Global Healthcast. In this broadcast series, we bring to you once a week news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and with me, as always, is Dr. Melvin Sanicas. Good morning to Switzerland. Good morning, Melvin.
Good morning, Professor Schmidt, and good morning, good afternoon, good evening to those who are listening to us or watching us today.
Today, in our edition, we will examine again, like here with a stethoscope, the globe, and particularly we have a focus on cancer and Fusobacterium. Melvin will look at general mechanisms how bacteria may be associated with colon cancer. And he then will cover Wakefield's study, in parentheses, on how misinformation can lead to significant public health challenges. And this is certainly all about measles. And we cover this topic because measles is back to the scene, many cases and many outbreaks around the globe. I will bring you an H5N1 update or a general update on pathogens that may cause outbreaks or pandemics in the near future. With that, let's start. Melvin, what is the story on Fusobacterium nucleatum and colon cancer?
Yes, so this is really interesting. The human gut contains trillions of bacteria. We know that some of them play helpful roles, like helping to digest food, but others can be problematic, causing conditions like stomach ulcers. Over the last decade, one of such species is called the Fusobacterium nucleatum, and it has been strongly implicated as a potential contributor to colorectal cancer growth. And now, basically in the study, they show that in the lab, this type of Fusobacterium nucleatum could survive for an extended time in conditions that mimic the stomach acid environment. And in mice, the presence increased the number of precancerous growths called adenoma in large intestines. So this is not in humans yet, but it gives us an idea that it could possibly do this to humans, right? And the different mechanisms that have been suggested are as follows. First is the promotion of inflammation, that this specific bacterium can trigger inflammation in the colon, which is also a known risk factor for development of colorectal cancer. The other one is cell proliferation, that the bacteria might promote cancer cell growth directly by interacting with the cancer cells. The other one is manipulation of the tumor microenvironment. It has been suggested that this specific bacterium has been shown to influence the tumor microenvironment, making it more conducive to cancer progression. And so that is really interesting. And last but not least, they have also seen that this bacterium can or might affect the efficacy of chemotherapy in treating colorectal cancer. So I think this is just the beginning, but it gives us some ideas that this could be a risk factor to address if we want to address the burden of colorectal cancer in the future.
Very interesting. I remember from my microbiology training when we isolated Fusobacterium, and I remember nucleatum. So this is a very nice memory of the good old times. When we opened the jars with the anaerobic bacteria, you could have the smell. I remember this now. And this is a hypothesis, right? But the hypothesis is substantiated with the pathogenesis theory. So this is a first step, as you say. This is hypothesis generating, and it may have real important implications for treatment or for maybe even detecting colorectal cancer. I don't know.
Yes, that could be what might happen in the future.
Yeah, very interesting. So Fusobacterium, a good old friend from my early medical microbiology training. What is this about? You have more on colorectal cancer.
Yeah, so I chose this because this is related to the first slide. And in this study, the author summarized the epidemiological studies on human microbiome and colon cancer and the progression of basically what we know about this specific topic, right? Understanding of the interplay between gut microbiome, the barrier function, and host response. And there is now growing evidence showing that gut microbial composition, or the differential prevalence of specific bacteria, really affects the presence of colorectal cancer, or the progression of this disease. And I think this is just showing us in this specific slide, right? That you will see here that these are the different mechanisms proposed. So it could be because of the bacterial toxins. It could be because of the metabolites of the bacteria. It could be because of microbial translocation, which is causing dysbiosis. And maybe this could be causing all these different problems on top of the environment, on top of the triggers of diet. And then all of these can cause increased permeability. Again, inflammation could be hyperproliferation of the cells, and then might in the future lead to colorectal cancer. So the reason why I show this is because this study was done before COVID, and the previous slide was actually a study done recently, but they are sort of related, right? They are talking to the same topic. Yeah.
And I just would like to remind our audience that we spoke about infectious diseases. I'm sorry, we spoke about infectious disease and cancer a couple of months ago, and it is really chronic inflammation that may result in cancer. And as you mentioned, Helicobacter pylori, right, causing stomach ulcers and stomach cancers. And then we had a couple of others that we mentioned where we know now that that particularly chronic inflammation and infection may be related with cancer.
Yes,
very interesting.
Hepatitis B, Epstein-Barr virus, many others.
Yeah. Very nice. Now we talk measles, and again, there are outbreaks around the globe in many countries right now. And you bring up the story from Wakefield. What is the story?
Yes. So the controversy of the measles vaccine really started from this old study that was done by Andrew Wakefield, and this was in 1998. Andrew Wakefield is a British surgeon. He published this paper in the medical journal The Lancet, and he claimed to find a link between the measles, mumps, and rubella vaccine and autism in children. And the findings in this study, which has now been retracted, right, this led to widespread media coverage and a significant drop in vaccination rates. And of course, parents and guardians of kids, they were very fearful, and they mistrusted vaccines. And this led to increase in the anti-vaccine movement. And of course, it led to the decrease in vaccination and subsequent outbreaks of measles, right? And I think it's important to note that the claims in the studies have been debunked, and the claims are untrue. But in the study, Wakefield suggested that the MMR vaccine caused bowel disease and autism, and it was based on a sample of only 12 children. And it hypothesized that the vaccine led to a series of events, including intestinal damage, which then allowed harmful proteins to enter the bloodstream and ultimately the brain, purposely leading to autism. So this study, again, was retracted because subsequent investigations into the research revealed significant problems. This included undisclosed financial conflicts of interest and ethical violations, such as conducting invasive medical procedures on children that were deemed unnecessary and unethical. And the study data was also found to be manipulated. And so this was retracted in 2010. So imagine from 1998, when it was published, it was only retracted in 2010. And this was after a series of investigations by journalist Brian Deere. And the findings of the General Medical Council in the UK concluded that Wakefield had acted dishonestly and irresponsibly, and he was subsequently stripped of his medical license. So yeah, although this study has been retracted and debunked, you will see the studies over and over again quoted in blogs, in vlogs, in social media, in the internet, and as you know now, people think that whatever they see on the internet is is true. So it's very
Yeah.
difficult to explain to people that what they are reading or what they are seeing is actually from a study that has been retracted and debunked because it is untrue.
Yeah. I remember in those days that people from Canada, from the United States, from around the globe called me and offered me research money to study the relation between measles, mumps, rubella, and autism. And I, at the time, we didn't do it. But in the end, and correct me if I'm wrong, I think lawyers bribed the author to get they gave him money because they wanted to sue and get yeah, I'm not sure, to get money for the damaged children, MMR damaged children, and for the lawsuits.
So these were discovered after that there was this part of the story where lawyers bribed
right.
parents to say that they had this problem with their children. And also,
Yeah.
on the one hand, it was found that Wakefield actually was working with a company to create his own vaccine, his own
Oh,
measles.
really?
Yeah.
Okay. Yeah. Yeah. I remember this. If you want to know all the details, there is a book on it by Paul Offit. And read the book if you really want to know the whole story. This is really very timely that you bring it up, Mel. Very good. Let's go to H5N1. And actually, earlier I got the, whoops, this is one too many. H5N1 update from the United States is still 2 cases only since 2022. There is one of these cases from exposure to dairy cows and one to exposure to poultry. And the reports come from 2 states. And here you see the wild birds that have been infected in the United States, wild birds and then poultry, and finally dairy cattle. So basically, there is not much new information. What we hope will not happen will be human-to-human transmission. And Melvin had explained to you in our last session how cows may be the melting pot for different influenza virus, H5N1 plus human viruses, so that you get the bad characteristics from the 2 strains, the H5N1 giving you severe influenza and you may die from it, and the human influenza strain that may increase transmissibility. So this is what people around the globe are looking for. And it is very important that we have surveillance for this around the globe. Right now, be aware of it, but there is no reason for increased concern at this point. Melvin, any questions from here or additions?
Not a question, Professor, but just to add that the authorities in the U.S. also mentioned just quite recently that if you are living there and you are concerned about getting H5N1 in beef or cattle, just make sure that you cook the meat properly. They said that the viruses are not able to survive heat when you cook the meat. Yeah.
Yeah. No rare steak, but burger, right?
Yep.
Very good. All right. Then there is a very nice paper published by colleagues that I know from my former, from two decades ago. It's from proactive surveillance for avian H5N1 and other priority pathogens for mass gathering events. So the story is if you bring together people from around the globe, like for the European soccer games, or for Taylor Swift concerts, or for whatever, you bring them around from around the globe, but in many countries, and then they meet, and then they may bring their outbreak pathogens, and these pathogens may even mix, reassort, and there may be a pandemic or at least an outbreak locally. So the concern is mass gatherings, and mass gatherings, they should have advanced risk planning, risk assessment, updates on guidance for country who host the event, what should be done in case there is an outbreak. Then it concentrates a little bit on the avian influenza viruses that have been observed in recent years. Then they talk about the highly pathogenic avian flu, HPAI, H5N1, and specifically on Saudi Arabia, as the author Memish is from Saudi Arabia. And I remember from the past, in the time that I know him from, he was responsible for infectious diseases in this country. And they are expecting 1.6 million pilgrims for the Hajj pilgrimage. And this is really a big mass gathering. So they really need to be aware of that. They already do have recommendations for vaccines, specifically for Neisseria meningitidis, for meningococcal vaccines. So follow the rules and make sure that you have a safe travel to your pilgrimage or to whatever type of mass gathering you may be looking for. In the past, particularly the Hajj has been a quite safe place. There have not been any major outbreaks from these events. Melvin, anything to add here or any other views?
Yeah, I think Taylor Swift is coming to Europe soon, so this should be something that the European authorities should think about.
Yeah. Actually, I just heard this morning that in Singapore, the Taylor Swift concert was attended by 300,000, by an audience of 300,000.
Yes.
And
because it was several days, yeah.
Yeah. So that is quite something, right? Just to make you aware of this. Enjoy the meeting, right? But be aware of the risks.
Exactly.
There, in the same paper, they highlight what the organisms are that people should look for. And there's certainly here this WHO list, and they updated this a little bit, or they summarized this here. You see Crim Congo hemorrhagic fever, Ebola, Marburg, these Lassa, and we covered those in the past, and certainly coronaviruses and some others. Then there are these re-emerging viruses, H5N1 we are speaking about right now, non-polio enterovirus, EV71, influenza A virus. Other than that, dengue virus, right? You need the mosquito there. So depending on where you are, if you go to the European soccer games, that may not be a risk, but there may be other risks instead. And then there are the bacterial pathogens where AMR, antimicrobial resistance, may play a role, and they are listed here. So this is the list of concern, and they call it epidemic potential of concern at 2024 mass gathering events. Very nice. So review this for your country, and depending on where you are, you certainly can adjust the list. Melvin, anything to add?
Well, I think they have covered comprehensively all these different diseases. But this is also something to think about for the Olympics, right? That's coming up in a few weeks in Paris.
In Paris, right. Yeah. And actually, there is always disease X. And as we said in previous podcasts, we said that there are 300,000 RNA viruses in animals ready to jump to humans. So we don't know what may come, but we should be ready if something happens. We should be prepared. All right. And then how do you prepare? And this is in another nice article by Kochima in the Lancet as well. You should have appropriate diagnostics available. Rapid tests won't be available immediately, but PCR testing, probably once you know the organism, can be available on a very short notice. Then you should do genomic sequencing. You should know the type of virus that is causing the pandemic or the epidemic, and you should be able to follow the changes of the virus over time when it becomes more less pathogenic or more transmissible, whatever characteristics you are looking for. There should be vaccine development and production. That is an issue because global vaccine production capacity may not be appropriate for the 8 billion people around the globe. If you have a 3-dose schedule, that means 24 million doses of a billion doses of the vaccine. That is quite something. mRNA production certainly has increased our capacity, but we need to be prepared in a wider range. There may be viruses that are not culturable, that you cannot attack with an mRNA vaccine. You may need cell culture, or you may need a recombinant protein. So this is something, vaccine development is something to look into in more detail. And then certainly something that did not go that well with the coronavirus 19 pandemic is communication and engagement could have been more optimal in many countries. I think this is another very nice paper that I highly recommend for reading, particularly those in public health offices. Melvin, any additions from your side?
Yeah, this also ties with the previous slide about Andrew Wakefield, right? Because there will be lots of misinformation out there, and for sure, if there is an avian influenza outbreak that can eventually be transmitted human to human, right? There will always be issues with information, misinformation, and disinformation.
Yeah. So this is something to worry about, and this is why we're doing this, right? We want to give you trusted information, and hopefully we can go on with that in the future, and hopefully many people follow us and listen to our weekly podcast. Melvin, that was it from my view. We had the Fusobacterium as a potential cause for colorectal cancer, and you explained mechanisms how bacteria may induce colon cancer or keep it going. We covered the story on Andrew Wakefield and his measles vaccine and autism story that was all wrong, and that was basically a scientific misconduct to begin with. And then we covered various aspects of H5N1, the latest numbers from the United States. There is no new concern. We checked how to be proactive with your surveillance at mass gatherings. We spoke about pathogens of epidemic potential of concern and how to build global preparedness for avian influenza. That's it for today. Thank you very much, Melvin, for your wonderful input and your articles that you showed us today. And I wish everybody a very nice week.
Thank you, everyone. Stay safe.